Well, it's Thursday, and of course, the Africa CDC COVID-19 update takes place every week on this day. Let's take it there live.
With your question.
Yes, Tim Cox from Reuters. I wanted to ask you, the COVAX cut its 2021 vaccine delivery target by nearly 30%, and it called on rich countries who had met their domestic needs to forfeit more volumes, and instead of administering third shots. I just wondered if you had any reaction to that, and how does it affect the vaccine buying plans of the AU's mechanism, AVAT, and also of individual African governments?
So the African Union member states have recognized that they have to count on their own capacity and capabilities, at least, to meet some of their vaccine demand. That is why we really need to celebrate the 400 million doses of vaccines that AVAT has secured. If you translate that to double doses, the equivalent of double doses, they represent 800 million doses. Remember, our denominator is 1.6 billion. That is what, when we stated as a target of immunizing up to 60% of our population, the required number of doses was 1.6 billion. We definitely need to adjust that number upward, given what we now know. So if you now put the AVAT doses in context, there is almost like securing up to 50% of those doses there. Now, the question he asks is pertinent, because even with the AVAT doses, it doesn't still allow us to get to a target of immunizing at least 60 to 70% of our population. That's why the partnership with COVAX and other bilateral donation is so important. Now, if countries begin to use or program the administering of the third doses there, it becomes problematic to achieve that the other requirement of meeting our 60% immunization there. So I think that will continue to be a challenge. The problem we have with the third doses is that we have not seen enough science behind that. And what do I mean by this? First of all, we do not know is at what point is the immunity, that is the level of neutralizing antibodies, decrease to a certain level that they stop offering you protection against disease progression. Remember, none of these vaccines will protect you absolutely from acquiring transmission there. So they do one thing, they slow down disease progression and hospitalization. So we just don't know that, and we have not seen data or evidence that suggests at what threshold we have that. Second is that even if we saw a decrease in the number of neutralizing antibodies, we don't have any evidence and science that says that if you get to a certain threshold, you progress quickly towards disease, or you actually are infected and you get hospitalized. We have not seen that. Those are the parameters that will enable us to actually make appropriate judgment as to when you require a third booster. Lastly, and very importantly, is that all vaccines are not made the same. So science will need to tell us that for every vaccine that you receive, this is the appropriate timing at which level that you need to get a booster. Whether you're receiving the AstraZeneca, Johnson & Johnson, Pfizer, or Moderna, or Sinopharm, or any other vaccine, we need to use science to inform us at what level you need that third dose or a booster. Without that, we should be gambling. We would all be saying we need a third dose, but it's not informed with science. So, for example, if you say, I received the Pfizer vaccine today, and then after 6 months, I get another booster. When do you expect to get the fourth dose? And when do you expect to get the fifth doses there? So it is really still confusing to me as to why we are moving towards a vast recommendation for a booster doses there. I fully understand that people with immunosuppressed diseases will need to boost up very quickly, because it is one can argue that the level of neutralizing antibodies have decreased significantly because of this their immunocompromised state. But for otherwise healthy individuals have not seen enough science that will require that we issue policy guidance that will lead to a third dose or a booster dose. If we continue to do that, then we should actually increase the manufacturing capacity in developed world so that they should ramp up the production of vaccines to immunize their own population to get to that level. We have seen what is going on in Israel, seen what is going on in the United States, where even after immunizing to a certain level, you are still challenged by the introduction of a new variant. Today is the Delta variant. Tomorrow, we just don't know which variant will be out there.
Thank you very much for that. Let's say good morning to Coletta Wanjohi. And Coletta is with the Feature Story News, FSN. Good morning, Coletta. Please go ahead with your question.
Thank you, Madam Wen. Good morning, Doctor. My question is just a kind of follow-up to the issue of community surveillance as far as trying to meet the problem of testing is concerned. Doctor, you say that we'll begin to send out community surveillance teams and all that. How will that work? Because what we have right now is people are testing, maybe because they're traveling or because they have to, they've gone to hospital and all that. How will that work in a situation whereby a lot of people within the community do not feel the urge to volunteer to just go and test for the sake of it? Thanks.
I think, Coletta, that is a very, very important question. That is exactly why we need to launch a vast campaign to address, to shift our testing strategy from testing those who are traveling and or those who have symptoms and want to confirm that. If we keep doing that, that will not enable us to conduct appropriate surveillance in the community. Surveillance doesn't just target people traveling or individuals who feel like they are sick. Surveillance is a continuous activity that you use a systematic approach to collect data so that you can interpret it and act on the data there. So, for example, if we were to sample Addis Ababa, we would develop very standardized protocols that will enable us to look at different components of the community so that we know exactly what the positivity rate is, and we can compare that with after 1 month if we do the same sampling to see if there have been changes at the level of positivity rate there. I think we also have to build in a counseling component, which we say that, well, if someone is tested, you take upon your own self-responsibility to extract yourself from the community, stay home for a few days and do a repeat testing. So testing to know your status, testing to confirm symptoms will still go on, but at least we'll be taking action to that. But we'll also be looking at a community analysis to see where the percentages are. Say, for example, if we did community survey in one section of Addis, and we are doing that systematically, and the positivity rate is 9% this month, and we do a repeat survey and it's 12%, it means something is going on in that community. We can either do enhanced campaign there for people to ensure that there's public health measures being implemented to slow it down. What we really don't want to be seeing is where suddenly you reduce the peak of the pandemic to a certain level, maintain it for 2 months, and then you see these spikes that come in almost like a lightning. They come up very steeply and they overwhelm our health system there. So it will be challenging, but again, we are in a very tough situation. We have to use everything. And the centrality of good public health is surveillance. So we really need to bring surveillance back to bear as an important tool to fight this pandemic.
Thank you very much. We go now over to South Africa, Johannesburg, to say good morning to Sophie Mokoena. And Sophie is the SABC foreign editor. Good morning, Sophie, and go ahead with your question, please.
Dr. Nkenkasong, yesterday, both the UN Secretary General, when he was speaking to the SABC in New York, and also the World Health Organization's director, Dr. Tedros, they were very, very frustrated and visibly angry in terms of access to vaccines. You have the two big gatherings coming, the G20 and the United Nations General Assembly, where you'll have world leaders. What is your message to the world leaders on issue of access to vaccine, because it looks like the Sub-Sahara is lagging behind, and there's no political commitment from world leaders to assist the developing South.
So, Sophie, I think that is, of course, a very pertinent question. I believe, and you all on this platform are witness to this statement, that we have been as vocal as we can as the African Union, as Africa CDC, with respect to the immoral, the morality of lack of access to vaccines on the continent. From days one, we have been very, very vocal about this. And we were the first to state, I remember on the 31st of January last year, that I was very clear that we are moving towards a moral catastrophe. I was very, very clear. And at that point, people said I was hard, but it's not. Today, we are where we are. Africa's total number of people that have been fully vaccinated is 3%. So my message to the two important gatherings that you just mentioned is that we cannot continue to politicize this situation by making statements that we don't follow through with firm commitments. And we just pledges that do not translate into reality. I think that is one. Second is that we are not, as a continent, very keen in any definition of vaccine diplomacy that would mean that people make statements in the media that are not really backed with reality. Pledges do not put vaccines into people's arms. I think we want re-vaccines and not just pledge vaccines. When the G7 or G7 meeting, I believe, in London just a few weeks ago, you heard all the pledges that were made. I mean, up to about 1 billion doses of vaccines were committed. We have not seen 1 billion doses of vaccines. I just gave you our denominator. Our denominator is that we need to strive to get to 1.6 billion doses of vaccines. We are far from that. I insist on that denominator because when a country says we are giving Africa 10 million doses of vaccines or 50 million, we should always square that with a denominator. How do we get to 1.6 billion doses of vaccines? I think that my call to action will be that we are not going to win this war against the pandemic. I mean, we collectively, including the developed world, if we do not vaccinate everybody at speed. Otherwise, we should be embracing ourselves to living with this virus as an endemic disease going forward. That is, all I can say. I think we are not yet there. We still have a window of opportunity if we cooperate, if we really truly express global cooperation and solidarity and try to expand vaccination quickly. The quickest way to end this pandemic, Sophie, is to quickly vaccinate.
Thank you very much. We go now to Sydney Kawadza, who is the editor of a magazine called The Anchor. And his question is to do with media and how they can cover the COVID-19 pandemic. So he says, going forward, what means do you think that the media should adopt to ensure that people get the proper information as it relates to the fight against the COVID-19 pandemic?
So I believe the mainstream media has done exceptionally well in covering the vaccine situation, in my view. I mean, they have been extremely clear. I mean, most media organizations do have their own tracking systems. They share the right information. Where the greatest challenge has been with the social media. I mean, that is, and we have always said that, I mean, we can don't underestimate the power of one, which means if you receive false information, don't share it, okay? Because those who design those false information and miscommunication, they work on us mindset and psychology. They know that if they send even the most unbelievable information, it will be ridiculous to you. You laugh at that, but then you share it with a second person. They also look at it and they laugh, they share it with somebody. And we should not do that. When we get that kind of a misinformation, we should stop it. Okay, just delete it from where, and don't underestimate the action that you take at the individual level, how collectively it can become very powerful. The media, the mainstream media should continue to help us encourage the population to go out and get their vaccines. I see that the situation has changed a lot on the continent. There's really a vast movement towards acquiring vaccine or getting immunized, and we should continue to encourage the communities there. There's still resistance and pockets of resistance here and there, but I think overall I see that the people are moving in the right trend. I was in Morocco the other week, and in Kenya and Rwanda experiences, Nigeria. You see the population has been galvanized. They want the vaccines. And our greatest challenge now is where to get the vaccines in a predictable manner. So I think the media has a role to continue to mobilize the population to get the vaccines. But also importantly, to communicate that vaccines will not stop transmission, but that vaccines are designed to slow deaths or to reduce mortality and also reduce hospitalization. That is very important.
Thank you very much. It's time to say hello to Kara Anna, who is with Associated Press. Kara says Kenya has more than 5 million vaccine doses, but has administered less than 3 million. What do you say to countries that ought to have the ability to fully administer the vaccines that they have?
I think I've not seen the details of the situation in Kenya, but I would just comment on that very generally, that we should get ourselves organized. We fully understand as Africa CDC that there are challenges and will be challenges for countries to immunize at scale. That is the logistic challenges there. But we are 2 years, almost 2 years into this, 1 year and about 8 months into this pandemic. I think it would have enabled every country to get their systems in place to enable them to vaccinate quickly. So I think the key word here is not just immunizing, but immunizing quickly. I mean, this is a virus that is ahead of us. We are not winning the battle against COVID in Africa. I think let us be very clear with that. So I think countries like Kenya and other countries should really get organized. Secondly, and lastly, is that we as Africa CDC have mobilized and organized ourselves, and we are working with other partners to make sure that we strengthen and support countries to continue to roll out the vaccination. Okay, I mean, the acquiring of vaccines is one thing, vaccination is another thing, and we are really building the right partnerships with several member states to support them to roll out the vaccination.
All right, thank you. We have a repeat, or rather a second question from Bonisile Makubu. But before I give that, I just want to ask colleagues online that if you have any questions that you want to put forward, please do so now. And that WhatsApp number to use is +251 94 2310. +251 94 2310. But you can also, of course, come through live or use the WhatsApp, the question and answer section. All right, back to Bonisile Makubu, who is with the Times of Eswatini. There is a growing concern that people who have vaccinated against COVID-19 are testing positive for COVID-19 at an alarming rate in different countries. Could this be out of ignorance on maintaining the basic safety measures even after vaccination? Or perhaps could it be that there is a lack of effort from governments in terms of informing the public on what they should do?
I think that is a very pertinent question. And I think it's a question that I believe I've just discussed over and over, that it is, I'm asking for your help as the media to make sure that people understand that getting your vaccines do not stop you from testing positive. I mean, if you get exposed, so you continue to practice those measures, public health measures there. I think that's exactly what I've been saying. Now, You have to rely on your trusted public health agencies, and each country do have that. The Africa CDC is one of those public health agencies that will continue to educate and inform the public, but they cannot do that alone. I think the mainstream media will need to help us so that people really understand that you by getting your vaccine doesn't mean that you cannot be infected. So in other words, don't go out there and just rub yourself into the crowds and believe that you will not be infected. You will be infected, and you may not even know that you have been infected because the vaccines may actually completely protect you from getting sick. Okay, and but you test positive when you go to do your test, maybe for travel.
Okay, thank you. I'm seeing that Sophie's hand is up. I don't know. Sophie, is that an indication that you have another question?
We are going to have this UN General Assembly, and I think one issue that many leaders will be talking about is how we achieve the SDGs. And I think the SDG on health is quite important. In terms of the impact of COVID-19, if you look at the Sub-Sahara or the continent, what are your observations in terms of the impact of COVID-19 in achieving the SDG on health, and also issues related to teenage pregnancy?
I think, Sophie, before COVID, the continent was already primed and challenged to achieving its SDGs, the goals of its SDGs for health. So with COVID, you can almost imagine that that challenge has been multiplied. And there's evidence for that. The Global Fund has just published a very elegant analysis that shows the impact of COVID on HIV, TB, and malaria. I think no doubt about that. In terms of teenage pregnancy or overall mental health, I think there's clearly evidence that this is impacting different sectors, including an increased rate of teenage pregnancy, increased mental health problems that even need to be documented more. I think that is one of these areas that the commission that was set up by President Ramaphosa will be looking into very, very carefully there. So again, we are focused on what the pandemic itself is doing. And underneath that, there's a bigger crisis in health that is unfolding, and that will only come to the surface maybe after this pandemic is over there. But I think all our targets have been challenged, including targets that were set, that we have set for ourselves to achieve with respect to reducing HIV transmission, malaria, and tuberculosis, and others, including our immunization programs, not just those that you mentioned.
Thank you. Sarah Jerving has come back with a second question. And she says, what sort of leverage can the African Union exert to increase transparency from manufacturers of vaccines? So she gives an example. She says, the Aspen contract is not public, and manufacturers globally are not making fully public the information on how much they are producing and who is receiving doses. So that's an issue of transparency there from Sarah.
Yeah, so I wish I knew how to respond to that and what the African Union can do, but it's certainly something that we can raise to the high political level of the African Union. The African Union is a political organization. It certainly has its political muscles to call for greater transparency. I think those are some of the topics or areas of interest that we can take to the leadership of the continent, like our COVID champion, President Cyril Ramaphosa, our chair of the African Union, President Tshisekedi, or the chair of the African Union Commission. I mean, they can all raise their voices at different fora when they participate.
Thank you very much, John. I don't see any further questions that are coming in from all of our platforms. So I think this is the time for you to give us the summary of your key points from today's briefing.
Thank you, Wayne. It's always a pleasure to be with you on this platform and to ask for your help as we fight this unprecedented disease. I mean, it is very clear and has been very clear in my mind that without access to vaccines and rapid access to vaccines, you saw the numbers of people or percentage of Africans that are fully vaccinated stands at just around 3%, that we have a long journey to go on the continent in order to achieve reasonable targets there. And it is also very clear that except we all encourage the population to go out there and get their vaccines. Even when the vaccines arrive, it will be challenging. We just heard, I believe, from Kenya, it was maybe Anna's question from Kenya, having vaccines that are at hand. And so again, my message to all of you will be asking your help to encourage communities that you work in to go get the vaccines, so that the narrative is not that we have vaccines and we are not using it, but the narrative is that we need more vaccines so that we can get to 1.6 billion doses of vaccines, which would mean immunizing about 800 million people in Africa. So I think that would be my call for help from all of us. And lastly is that we are only going to win this battle against COVID if we deploy the whole of society. It is not one person's responsibility or a set of people. Pandemics have always won. The fight against pandemic is always won quickly if we work together as a community using a multi-sectoral approach. So that is really my message this week, is a call to action for people to go get their vaccines, continue to drive the whole concept of a moral social contract, which says that if I'm vaccinated, I protect myself. If I'm vaccinated, I protect my community, my family. If I'm vaccinated, I protect my community and I protect my nation. So that is a moral social contract that we all need to adhere to.
Thank you very much. That was Dr. John Nkenga Song, and he is the director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Bringing our press briefing for today to an end. Thank you very much for your participation today, as always. So the next time that we will meet will be on Thursday next week at the same time. From all of us here, bye-bye, and enjoy your African Union Day.
Thank you.
And with that, it's a break here on the agenda.